Hi, this is Dr. Amit from Rudraksh Physiotherapy Clinic. Today I am going to discuss many of the patients who are coming to our clinic right nowadays are complaining of mid-back pain, which is your thoracic area. They are saying that they are having pain over this green particular area, जो यहाँ जैसे है, this area, this particular area is paining a lot, and ये green area है thoracic spine का medial border of the scapula के इनर वाली एस्पेक्ट पे, यहां जैसे, तो यहां पे बहुत ज्यादा उनको पेन हो रहा है. नाउ देयर कैन बी सेवरल रीजंस फॉर दिस पर्टिकुलर टाइप ऑफ पेन. वन कैन बी, यू कैन सी देयर आर thoracic vertebra, cervical spine ends here. Here is your C7 vertebra. Cervical spine ends here. Now your thoracic spine starts. So there are 7 vertebrae of the thoracic spine that are correlating with the scapula, this wing bone, and 2 muscles are connecting the scapula with this thoracic spine. One is your rhomboidus minor and one is your rhomboidus major. So this is your rhomboidus minor and this is your rhomboidus major. So these 2 muscles are connecting the scapula with the thoracic spine. Now this particular facet joint between T2 and T3, you can say I have marked in red. These red joints, these are red between 2 vertebrae. These red portion that I have marked is a facet joint. Now this facet joint gets deranged when you are doing certain occupational activities such as long duration sitting, working on a laptop, or if you are working in some particular kind of banks and you are sitting for a longer duration in front of the computer screen, then these facet joints get deranged. Now these 1, 2, 3, 4, 5. So these are 6. So these are 6 facet joints which can dysfunction, and that is known as facet joint dysfunction. And then you feel pain over this area, and this area can refer the pain to the shoulder, and that pain gets referred to the shoulder. Now what is happening is one of these 5 or 4 or 5 facet joints is getting deranged. And if you understand what happens to a joint when you are sitting like this, it is opening for a longer duration. Suppose when I am sitting like this for a longer periods of time and I am sitting like this working on a computer screen, so now my facet joint is opening and it is opened for a longer duration and then it doesn't get closed. अब मैं पूरा दिन ऐसे नहीं बैठता हूं तो इसकी ओपनिंग एंड क्लोजिंग डिस्फंक्शन आ जाती है. सो फेसेट जॉइंट कैन हैव 2 टाइप्स ऑफ डिस्फंक्शन. वन इज योर ओपनिंग डिस्फंक्शन. I have written like this: OD, opening dysfunction, and one is your closing dysfunction. Now this opening dysfunction and closing dysfunction can again be divided into 2 parts. One is या तो facet joint कम open हो रहा है या फिर excessively open हो रहा है. So it can be excessive opening of the facet joint or reduced opening of the facet joint. और उसी तरह से 2 dysfunctions और आ सकते हैं. Closing dysfunction of the facet joint. It can be excessive closing of the facet joint or reduced closing of the facet joint. So when you are sitting for a longer periods of and working on a laptop, longer periods of duration, you are sitting like this, you are reading book, you are into some professor job in a university, then what happens, you are sitting like this and that facet joint is open for a very long duration and then it doesn't get closed completely. So I think for these type of patients, you have to check the occupation of the patients. What does he do? His history, how the pain starts. That gives us the clue. That gives us the clue that the joint is having a closing dysfunction. So that means that when you are extending your thoracic spine, the joint is not closing back properly. So how we do correct that closing dysfunction? One is by the manual technique. I have to fix the joint so that the joint closes properly and opens properly within their potential limits. And if you think that you are not able to devote time to go to a physio for the sessions, then I can tell you one exercise which can definitely cure the closing dysfunction of the facet joint, and this pain, this green color pain which is coming over to the inner aspect of your thoracic spine, will get permanently cured. So जिस तरफ आपको पेन हो रहा है, listen to this exercise carefully, जिस तरफ आपको पेन हो रहा है, सपोज मेरे राइट साइड में यहाँ पे पेन हो रहा है, तो मुझे राइट साइड से ये थेरा बैंड ऐसे बांध लेना है और लेफ्ट साइड से इस थेरा बैंड को पुल करना है. इसको मैंने पुल किया नीचे को एंड राइट साइड से मैंने रेज किया. नाउ माय thoracic spine is in complete extension and my facet joint is completely closing. T3, T4, T5, T6 facet joints are completely closing, and closing dysfunction can get okay. So you have to do this. You have to maintain this stretch for at least 20 seconds and then come back. For at least 20 seconds, you have to push this into shoulder extension, ऐसे पूरा पीछे को और ये पूरा ऊपर को, and like this, and इस तरह से you can see, and thus maintain the stretch for at least 20 seconds. This definitely is going to cure your problem, this particular exercise with the TheraBand. जिस साइड पेन है, अगर राइट साइड पेन है तो राइट आर्म ऊपर जाएगा, अगर लेफ्ट साइड पेन है तो लेफ्ट साइड वाला आर्म ऊपर जाएगा, ताकि फेसर जॉइंट्स की प्रॉपर क्लोजिंग हो सके. सेकंड एक्सरसाइज इज, एक और एक्सरसाइज जो क्लोजिंग डिसफंक्शन को ठीक कर सकती है. हम सपोज मेरी लेफ्ट साइड में क्लोजिंग डिसफंक्शन है, सो आई विल डू लाइक दिस. आई विल गो इनटू अ क्वाड्रीपोड पोजीशन. दिस इज अ क्वाड्रीपोड पोजीशन, एंड इस तरह से हम रखेंगे, और उसके बाद मैंने पूरा वेट दिया हुआ है. इस तरफ मेरे को पेन रहता है लेफ्ट साइड वाली साइड पे. सो व्हाट आई विल डू इज, आई विल गो बैक and then turn towards my right. Now I can feel the stretch. Again you can see quadripod position, पूरा weight मेरे हाथों पे है, and then I am going slowly back, and then I am leaning towards my right side, and I can feel the stretch on the left side. Maintain that particular stretch for at least 20 seconds. Repeat these both exercises for 10 to 15 times. I can assure you that if the facet joint closing dysfunction is there, you will be cured within 2 or 3 days, and you will be getting relieved of this particular pain. Thank you so much.